Let's also listen in to what the chairman and MD of Radiant Life, Abhay Soi, had to say about this.
It's a series of transactions. In step one, Radiant will be purchasing a 49.7% stake from Life South Africa. They are 49.7% shareholders in Max Healthcare at present. The balance 49.7% is held by Max India Limited, which in turn is going to be split into two companies. One is going to be the Max Healthcare company, which is going to be demerged, and the other, which is going to hold the Max Healthcare stake, and the other company which will hold Max Bhupa, Antara and some of the other allied businesses. Thereafter, we are looking to demerge Radiant as well of some of its other smaller businesses and investments, and merge Radiant Healthcare into Max Healthcare Limited, which then will be merged with Max India Limited, which is the holding company of MHIL's stake. So essentially what you will end up having is a pure play healthcare company which is going to be listed on the stock exchange. In the end, there will be two listed entities. One is going to be Max India Limited, called by another name, which is going to hold the Max Bhupa, the Antara, as well as the allied businesses. And the second company will be Max Healthcare, which will be the listed company, which will be held by myself, as promoter with a 23.2% stake, with KKR as co-promoters with a 51.9% stake, and 7.1% stake will be retained by the present promoters of Max Healthcare India Limited, although thereafter they will be declassified as promoters. So I think there are a huge amount of synergies between the two, because both are very complementary businesses with a similar value proposition, both to doctors as well as patients, and operate in very high-end quaternary care. So really from solid organ transplants such as heart, liver, kidney, bone marrow transplant and so on and so forth. Both the enterprises have again state-of-the-art technology in terms of robotics, Da Vinci, whether it's the LINAC machines and so on and so forth. Synergies really are in the context of the cost structures would be that Max does manage their variable cost significantly better than Radiant, and Radiant manages its fixed costs significantly in a significantly better manner than compared to Max. Then when you put it together, then you see that it will be a best-in-class EBITDA margins. Well, we will be the third largest in terms of revenue across the country, and we will be the fourth largest in terms of total number of beds in India. So, there's a critical mass. There will be economies of scale from that standpoint. The fact that it is metro-centric rather than spread across different geographies is an advantage, because metros have a lot of similarities, especially metros of Delhi and Bombay, which again, besides the other businesses, also given to medical tourism because of simply the connectivity which it has with the rest of the world. So also the fact that a lot of the businesses then are dominant in the NCR region, it furthers the leadership position of the combined entity, from a cluster standpoint, and that itself will have its own benefits and synergies. So, there are significant strategic benefits. If we look at the availability of land at Max in Delhi, in terms of Max Smart, where we are looking at expanding the capacity by another 650-700 beds. Similarly, in Mumbai, for us to be able to expand, and we are expanding the capacity by another 600 beds. So you can look at two pivots which are of the organization going forward, which is essentially going to be almost a 1,000-bed hospital in Mumbai, and similarly one in Delhi, in South Delhi, and these are arguably perhaps the two best locations for healthcare, and perhaps the two best micro markets within these locations. So anybody having such large format hospitals in Delhi and Bombay propelling the enterprise is definitely going to be a very attractive proposition for investors as well.